We've made slow but really great progress in the 20 odd years since Ash co-commissioned Anne McNeil to write a review on mental health and smoking. And at the time, no one was talking about smoking, certainly not policymakers. And we're now in a position where we have evidence and acknowledgement of the role smoking plays in the onset and maintenance of poor mental health. And Ash, together with other organisations, have recently just published and synthesised the current evidence base on this. So what I'm going to do in this presentation is look at, does smoking cause poor mental health, or does poor mental health cause smoking, and then just whip through the self-medication hypothesis and the misattribution hypothesis and evidence of a causal relationship between smoking and mental health. So you'll all be familiar with the self-medication hypothesis that suggests that people with existing poor mental health smoke to self-medicate their mental health symptoms, and that if you take medicine to treat your psychosis, then you can treat the side effects of your medication. And that initially was hypothesized because people who took medication had movement disorders, and lower movement disorders were in smokers compared to non-smokers. But there's lots of problems with this hypothesis. It doesn't quite stand up, although people often report that they smoke to manage their mental health. Because if you look at amongst heavy smokers, they have worse mental health. And in terms of the medication people take for their psychosis, psychiatrists often correct for the speeding up effects of smoking has on the metabolism of lots of antipsychotic medication. So people end up with higher doses of medication. And as we've known from Cochrane reviews recently, your mental health gets better when you stop smoking, and the longer you stop smoking, the better your mental health gets. And historically, some clinicians have used the self-medication hypothesis not to intervene and not to act, because they think smoking calms their patients, or that if they stop smoking, people's mental health will get worse. And that's not the case. In terms of the misattribution hypothesis, that's to do with people thinking that smoking is relieving their distress or stress in some way. So nicotine is delivered to the brain in tobacco smoke really, really quickly, and then it stimulates your nicotine receptors, and then that leads to a boost of dopamine. So smoking, because dopamine is a teaching signal, it teaches the smoker to repeat the action of puffing on a cigarette. But it's also negatively reinforcing, because nicotine only stays in the body a really short time. So as soon as you put out a cigarette, then you are going into withdrawal, because nicotine only stays in the body. It's got a half-life of about 2 hours. So if you don't top up your nicotine levels quite regularly, then you'll have withdrawal symptoms. And the quickest way to relieve your withdrawal symptoms is have another cigarette. So people who smoke can sometimes then misattribute the ability of cigarettes to relieve depression, anxiety, irritability, which are withdrawal symptoms, and they then get that confused with, well, it helps my mental health. When in fact what smoking is doing is replenishing nicotine, which then reduces withdrawal symptoms, which then reduces the distress of those withdrawal symptoms. And we know from lots of observational studies, so cross-sectional studies and repeated cross-sectional studies over a long period of time, that mental illness like depression and schizophrenia increase the risk of smoking, but we also see that in the other direction as well, that smoking increases the risk of some mental health problems like depression and schizophrenia. And observational studies are good, but they're limited because they can't help us know which comes first. Does the smoking and the mental health problems come first, or is it the poor mental health and smoking that comes first? And then more recently, what we've had is, and another thing that makes it all quite confusing and you need to disentangle, is that other factors independently affecting the onset and maintenance of smoking are poor mental health. And recently we've seen a growth in a particular statistical technique and research method called Mendelian randomization, which takes a genetic approach to help our understanding of the causes of lots of illnesses. And so it's where you group genes from millions and millions of people according to their genetic code and look at their genetic differences that affect smoking and illness and vice versa. And this type of research design can help work out which comes first and whether there's any confounders. And so in a report that's commissioned and on ASH's website, colleagues at Bristol University found that people who smoke have an increased likelihood of developing either schizophrenia or depression. There's some evidence for smoking causing bipolar disorder and for bipolar disorder causing heavy smoking. There's less evidence of a causal effect for smoking on other mental health conditions like ADHD and anorexia. Smoking gets in the way of recovery of mental illness, so people who smoke have much more severe symptoms of psychosis, they spend longer time in hospital, they need higher doses of medication, and smoking drives them into poverty. So clients spend about a third of their income on cigarettes. Cigarettes are used to exploit and stigmatise people, and it gets in the way of adaptive coping skills. So people who smoke are less likely than non-smokers to use alternative coping techniques. And so what happens then is people get locked in a cycle of smoking and poor mental health, where the uptake of smoking increases poor mental health, and then poor mental health increases the risk of smoking and leads to higher dependence on tobacco, and that higher dependence on tobacco makes it difficult to stop smoking, and then you just get locked in this ever revolving cycle. So in terms of the gaps, there's still a lot of research gaps in this area, and we need more research on the role of nicotine in the onset and maintenance of poor mental health or improved mental health, but we need to uncouple that from tobacco smoke, because we're still not quite sure, is it the nicotine or the 7,000 other toxic chemicals that's in tobacco smoke, but also the behaviours that are associated with smoking. So to summarise, poor mental health leads to smoking, and smoking leads to poor mental health. And there's a stronger and growing evidence base for the latter. But quitting smoking improves your mental health. So it's really, really important to research this further, because the more evidence we have that smoking causes the onset of poor mental health and makes it worse, the more we can do to change the culture of psychiatry and change the hearts and minds of the workforce, but also people who use services. But we can't wait for lots of genetic studies and Mendelian randomization studies. So the implementation of evidence-based interventions to prevent uptake and help people stop smoking is also absolutely vital, because this is where we can have immediate and positive impact. Thank you very much.